Like, okay, here we go. All right, this is the second session for getting hip with heparin drips. I'm going to sit here so they can view me. Welcome and thank you for coming today. This is going to be a review or a refresher for the PACU staff regarding heparin drips. I know just doing this project myself, it was a whole new refresher for me. I haven't touched a heparin drip since my ER days. So, Charlie, do you know when you've last done a heparin drip?
It's been about 20 years.
20 years. How about you?
It's probably about a year and a half.
A year and a half. So you're a little bit more up on it than we are. So it's going to be a quick refresher. I've got 3 little YouTubes to watch, and we can bypass them if you are familiar. The first one is going to be a refresher for the Plum IV pump. So are you familiar with how to flush load the pump with a cartridge and flush the lines and everything?
I have not done a heparin drip since we went to the type of cartridges we have now.
Okay, but have you done any pump infusions? We can go through that and watch it. It's really quick.
Go for it.
Go for it. Okay, Charlie.
Yeah.
All right. So this is for my leadership project that I'm doing. I'm taking my BSN completion program online with Eastern New Mexico University out of Portales, New Mexico. I'm in my last semester. Yay! And so this is my leadership project for the semester, and we're doing. This is part of my practicum that I'm delivering this education piece, and then we have theory as well. So here we go. And so the reasons we're doing heparin pump training here at Del Seton in the PACU, obviously our patient acuity here in Austin, the population is increasing. You know, this is like one of the favorite cities for people to move to. So our population is increasing. We are having increased ICU overflow patients into the PACU area. And so PACU nurses are compelled to expand their scope of practice to recover more complex patients. Another bit of research I've delved into, the Institute of Medicine has, in their 2010 plan, have a vision that a lot of the healthcare now is going out into the community. And those that are left in the hospital were taking care of sicker patients. Hence, the staff are being asked to basically cross-train to different areas and add more skills to their nursing repertoire. So this is part and parcel of Seton's vision, the peri-anesthesia services here at Del Seton, to have PACU nurses cross-trained into the ICU realm. And Charlie, you've been one of those nurses that have had the education before we moved from Brackenridge to Del Seton, you and Linda and Michelle and all the others. So you're kind of halfway in that education group. And were you privy to that as well? Or have you had ICU experience?
She's got more recently.
Good. So, and that's what they're doing too, is they're hiring ICU nurses, or nurses with ICU background, to help with that transition. And we're kind of in the midst of it right now. I think their goal is to have it up and running by the middle of next year. So I'm part of this. I'm just doing a little chunk of information to help you along with this transition. And so the goals of our heparin drip training are to, again, facilitate the PACU nurses in their education, smooth the progress for the nurses' critical care competencies, ease your peri-anesthesia nurse knowledge gaps, educate the staff to manage the heparin drip tasks into their skill set, and become proficient and comfortable controlling the heparin drips in the PACU setting. If you have any questions, comments, or concerns while this presentation is going on, please don't hesitate to ask. I kind of have a love of the old vintage nursing postcards.
I like that.
And so I pulled them up, so I just kind of keep your interest. I was lucky to get, as a gift from Eastern New Mexico University, a book on the vintage postcards for nursing for an award that I won. And so I thought, oh, this is so cool. So I thought, plug these
they're
in.
pretty fun.
Yeah, they are. There's some of them are interesting. So here's Charlie. This is for you. This is the YouTube. Now, unfortunately, I don't know how I'm going to get it. It doesn't show up on the screen, but I'm going to switch the laptop around, and we'll get it going here. And it's actually a nice little nursing student. That's doing the presentation. She's really cute.
We are here at the pediatric unit of the Center for Simulation Division. The purpose of this video is to introduce you to the Plum IV pump, which is used at the Methodist Hospital, and this will help you with your clinical experiences at the hospital and also with simulation here in your office. Okay. So first, we would prime your IV bag with this tubing, which would be your primary IV plum set, and it's specific to the plum pump. So you have your bag here. First, you want to make sure that your tubing is clamped, so your fluid doesn't flow down the tube. Ready to prime. Make sure to keep everything sterile.
She's really good at this. For a
Before you
student,
start priming your tubing, you want to make sure that you're holding your cassette, which is this one, so that your dome chamber is on top. Okay? Go ahead and squeeze. Unclamp here. And this is your screw here, and it serves like your roller clamp. It regulates the flow of your fluid into the tubing. And watch your fluid. And you're waiting for the dome to be filled with fluid right there. Once you see fluid on your dome, we're going to flip the cassette. Good. Once your tubing is all the way primed, you just push into this white screw to stop the flow. Now we're ready to insert the cassette into the machine. So you just pull this up, and you hold it like this. Your white screw goes right into their hole over there. So this just goes in one way. That just slides there.
I always have the worst time getting those in there.
Every once in a while, I am challenged, like, what the hell?
Because it should have like a
It's
nice
gonna run
slide,
self-check.
but it doesn't.
So we'll just wait for that.
I know. I've felt silly at times.
So
Like,
this
I
is
know
your
I've done this
pump.
before,
You have
damn
your
it.
card keys here, which has your start, your stop, on and off, your numbers, your arrows, and your silence button right here. And then you have your soft keys, which is these arrows on top. And these change on the screen depending on what you're doing with your pump. And examples of what you're probably going to see there is back prime, your channel A and B, and options and volume infused here. Okay. Right, so I think we're ready to program our pump. Now that we've connected the tubing to our patient, we're ready to program our primary line. So you'll pick channel A, and this will show up. So you have three variables here. You have rate, volume to be infused, and duration. And you only need to put two variables in. And the third one, the machine calculates it for you. So we'll set a rate at 40 mils per hour. And then you just go down to VTBI, which means volume to be infused. And in the pediatric world, we want it to be set to a 2-hour maximum. So with that, that's 80 mils per hour. And you see how the duration is already calculated for you. So you just go down there, and if you want to change your hours or minutes for later, you just do the down arrow, and it goes to the minute bit. All right. So then
I'm still learning things.
push your start button.
I learned that
And you
this
see this blinking light here on channel A, and that tells you that your fluid is running and flowing, and that's your channel A, your primary line. Now let's go through common interventions that you may do with your pump. So for example, you need to change your volume, say your fluid has gone all in. So again, you'll pick channel A right there. So you'll just go down to volume. See, it's 0.2, so we'll change that to another 80 for another 2 hours. Put that in there and then just click start. Now, if you want to change the rate, say you want to change the rate to 50, kind of similar to the volume, we'll just change that to 50, and then just start it again. Okay? Finally, if you want to give our patient a bolus, say you got an order from your doctor to give a bolus, click again, channel A, and say a bolus of 100 mils, you'll go down to volume with your arrows, and put 100 mils, and you want to give that over 30 minutes. Now you don't want hours, so clear that and go down to
This way you
minutes.
go to minutes.
30 minutes there, and see how it calculates the rate for you. And just start. Our pump has two channels. Usually the first one is used for primary IV fluids, and the second channel is usually for medications, which come in either a bag or a syringe. So your syringe comes from the pharmacy ready to go, but your bag needs to be primed. So we need a piggyback IV, and it says secondary IV there. So that's what you need. And you'll see this hanger, and with this plum pump, you can either use this or not. It doesn't matter. We're not going to use that for now. Ready to prime your tubing. Make sure to
You don't see those hard plastic
all
bags
the way.
anymore. Do you still see them?
That kind there?
Kind,
Yeah, it's funny you mention that.
Yeah.
It's been a while.
It's like an older style.
Yeah.
So clean your hub.
Scrub the hub.
15 seconds.
That's a quick 15.
It's a filming
But
trick.
this is a filming trick.
Yes.
Yes.
Unclamp this all the way. So select channel B, and again it says piggyback. Go down to volume, and our bag is 100 mils. And we'll run that in 30 minutes. So go down, and down to minutes, 30 minutes. And that's going to run at 200 mils per hour. Start. So let's connect the syringe to the pump. First, we want to make sure we have the right medication for the right patient, and there's no air in it. There's no air. In the hub, 15 seconds. Keeping everything sterile. The screws right here. Okay. So we'll select channel B, because that's a secondary line. And it says piggyback, go down to rate. And this is vancomycin. Volume to be infused is 28 mils. Tells you there in the syringe.
Right there's a
Vancomycin we
pediatric
give
dose.
over an
Huh?
hour.
And that's what she's doing is pediatrics.
Yeah,
But,
yeah.
It can relate to adults.
Oh,
too.
totally, yeah.
Common alarms that you may hear include air, occlusion alarms, or high pressure. So first you want to just push your silence button, read the screen, and if you're unsure, just call your instructor or your RN. Thank you. This video has been helpful.
She was really cute. She did a great job.
Mm-hmm.
Yeah. I'm trying to get my mouse going here. There we go. Okay. So that's the YouTube. You're welcome. It's a little bit of a refresher for those that have not used it in a while. Let's see. And then here, the next one, I'm going to go back up to the screen here. You're familiar with how you get to see policies and procedures. And I have the computer up here. So, right up here on the internet, there's your policies. All right, let's get in there. Just click on here, and you can get into all your policies and procedures here. Okay. The anticoagulant website has got links to this as well, and takes you directly to your policies and procedures. You can also keep them as favorites. Okay. And so that's how you would get to our policies and procedures regarding heparin administration. I like this website here, the anticoagulant one, that we can directly get to and have everything, all the links to all the information that you've got underneath that. So,
Now, when you go on the internet, how do you come to this
so you can put in the search. I think there's let me back out of here, Charlie.
Sure.
And I believe there is a link on the internet. I'm thinking maybe. Right here under clinical practice, anticoagulant management.
Oh, okay.
It's one of these links. So go under clinical practice, and you click on that and it gets you into, go there, come on back, and it will get you into that anticoagulant management website, and it's chock full of information for you to read at your leisure. And there's guidelines, there's the policies here on warfarin therapy, managing anticoagulant therapy, guidelines, there's perioperative management, I've got copies of that over there, anticoagulation in adult patients, your enoxaparin, rivaroxaban, or Xarelto,
Yeah.
dosing, they go to pediatrics, pills, and patient information, there's education for patient information, and then other resources, and protocols and PPOs, and then there's pediatric and neonatal care at the bottom. And you can click on all of those links and it will take you to whatever particular type of therapy you're dealing with. Anything that's underlined is a link.
Yeah.
Okay.
Do we have a protocol for stroke?
I'm sure we do, and they would, and whatever their order sets are, they link it to probably either STEMI or Thrombo, and I've got copies of the order sets there. There's about 3 or 4 different order sets for anticoagulant therapy, and they'll pick one of those. I picked out 2 for our trained away here for STEMI, fibrinolytic therapy, and then there's adult heparin. Those are 2 main order sets that you'll probably use, either STEMI or adult heparin infusion therapy. So we'll get to that. I've got 2 other YouTubes here. One is the first one is the guy is talking. There's no pictures, and he's just talking about heparin therapy. And so we'll just listen. It's very short.
Cause of pulmonary embolism.
And I want to back up. For some reason, it goes right in the middle of the.
Heparin is a medication that every nurse, every medical professional needs to know. Its trade name is Heplock. You're going to refer to it as heparin. That's just simply how you're going to hear it. The reason we give heparin is to prevent venous thromboembolism, VTE prophylaxis and treatment. We can also give it a low dose to ensure patency of IV catheter. So the way that it works is it actually increases the inhibitory effect of antithrombin on factor Xa. So with our clotting cascade, we have thrombin, we also have antithrombin. Antithrombin actually prevents the clotting cascade from actually occurring. So what happens here is we give heparin. Heparin increases that inhibitory effect of antithrombin, and specifically on factor Xa. Therapeutic class of heparin is anticoagulant, pharmacologic class is antithrombotic. The biggest things to keep in mind here, guys, are that we need to monitor for signs of bleeding. If we see any petechiae or anything like that, we would want to assess and understand and recognize that that is a sign of bleeding. We also want to monitor our patient's platelet count. If platelet counts drop too far, the patient might go into a stage where they are not able to clot at all. And so we really want to monitor that we're getting this, but we're not going too far with it. Heparin can also cause hyperkalemia, and we want to have the patient report any signs of bleeding, any coughing up blood, any fluid blood, any of this petechiae, any redness in the eyes or anything like that would be signs that the patient might be bleeding. So heparin is given in the subcutaneous tissue. The best place, the normal place that we a lot of times will get it, will be kind of right around the belly button, about an inch outside the belly button, and the love handle. We want to pinch up some fat, give it in the subcutaneous tissue, which simply means fatty tissue. Any patient that's in the hospital, let me not say any patient, most patients that are in the hospital for more than a couple of days will start taking heparin because we really don't want any VTEs, venous thromboembolisms. Because what can happen with these is they can begin to travel through the system and they can get lodged in the vasculature and cause a stroke, or they can get lodged in the heart and cause a heart attack. And so we really have to prevent that. They can also get lodged in the lungs and cause a pulmonary embolism. Okay? So we really have to prevent this, these deep tissue venous thromboembolism. And by preventing this, we keep the patient out of having one of these PE, stroke, heart attack, and we keep the patient healthy. So big thing to keep in mind here is not blood thinners, okay? These aren't blood thinners, they're anticoagulants. And so what they actually do is they prevent coagulation. They don't thin the blood, they prevent coagulation from occurring by increasing the effect of antithrombin. Alright, so that's really important to keep in mind. And that's heparin. You will give this medication, and it will really depend on, usually it's given about every 8 hours in the hospital, so usually 3 times a day. A lot of times I saw it given twice at night shift, and usually 10 p.m., 6 a.m., and then once during the day shift. So heparin really doesn't have a huge half-life, and that half-life, that's why we give it, the 3 times a day. We can also get a patient on a heparin drip. If the patient really needs anticoagulation, in the sense like MI, we would put the patient on a heparin drip, and we would draw serial PTT, monitor what's going on. So PTT is the lab value we're going to run for a patient to determine what their bleeding time is when they're on heparin therapy. PT-INR is going to be with warfarin Coumadin, and PTT is going to be with heparin. The antidote for heparin is protamine sulfate. That's important to keep in mind because we can get our patients into a state that they are not clotting anymore. They're not clotting fast enough, and they may start to bleed. They may have bleeding intracerebrally or elsewhere. And so what we would give in those cases is we would give protamine sulfate. And protamine sulfate works as the antidote for heparin. So heparin, very important medication to keep in mind. You're going to see a lot. So that's everything that you really need to know, the essentials. This has been another episode of the MedMaster Podcast by NRSMD.com. To get our free cheat sheet showing the 50 most commonly prescribed medications.
This guy's good. He talks about all kinds of drugs.
He's a good talker.
Thorough, yes. And then the second one, age population brings up, she runs through the calculations of the drips and whatnot, and it's really thorough. But no, so you don't get stressed out. Pharmacy will do this for us. Okay, but I like how she does the calculations here. It's kind of, again, a refresher.
We're going to look at several different heparin calculations. We're looking at this because heparin can be given as an injection or heparin can be given as an IV infusion. Let's take a look at several problems. In our first problem, heparin is to be given as a subcutaneous injection. And so we see here an order of heparin for 16,000 units subcutaneously stacked, and we see a med label telling us how strong the heparin is. In order to figure out how much to administer, I'm going to use dimensional analysis. Keep in mind that this problem could also be done using the nursing formula or using a proportion. So the order is for 16,000 units. Be careful with all those zeros. And that is given as a one-time dose. The strength of the med is 20,000 units, and I put that on the bottom of my fraction so that the units cancel. And that 20,000 units is in 1 milliliter. So my label of units will cancel, and I'm ready to go to my calculator. On my calculator, I'll type in 16,000, and I'll divide it by 20,000. Come up with an answer of 0.8 milliliters. So on my work, this will equal 0.8 milliliters. Because this amount is under 1 ml, if needed, I could round it to the 100th place or 2 digits in the decimal. However, I did not need to round for this particular problem. Take a look at a second problem. This time heparin is to be given as an IV infusion. We see an IV bag. We'll notice that the strength of the med is given in 2 different places on the IV bag. We can use either concentration, the amount for the full bag, or the reduced fraction. They truly are equivalent. Again, I look at my order. This time my order is for 1,500 units per hour. And I should figure out a milliliter per hour rate. I'll start with the ordered amount, and I'm going to use dimensional analysis. Although again, it's possible to use a proportion or to use the nursing formula. In dimensional analysis, I'll start with the 1,500 units per 1 hour. And then I'll multiply by the strength of the med. I'll use the reduced fraction, although it truly does not matter. In the reduced fraction, there were 100 units per 1 milliliter. The units cancel, and I'm ready to go to my calculator. On my calculator, I type 1,500 and divide by 100 units per milliliter, and my answer is 15 milliliters per hour. Because this is an IV rate, I would typically round this to 10th if necessary. In this case, I did not have to round. Let's look at one more problem. This problem asks us how much heparin will the patient receive. We're told that heparin with 40,000 units and 500 milliliters of 5% dextrose water is to infuse at 30 milliliters per hour. We're asked to calculate the hourly heparin dosage. So I'm going to take the information that I'm given, this rate, and change it so that it is units per hour, which is how heparin would be measured. I'm going to do this with dimensional analysis. This particular type of problem is harder to fit into the nursing formula. You could set it up as a proportion, but truly dimensional analysis is probably your easiest option. In the dimensional analysis approach, I want the milliliters to cancel. So I'll put the 500 milliliters from the IV bag on the bottom of my fraction. The 500 milliliters goes with 40,000 units. And in this setup, the dosage strength has allowed me to change the milliliters into units. Go to my calculator, and I take 30 times 40,000, be careful with all the zeros, and then I divide that by 500. I get my answer of 2,400, and that would be units per hour. So I have converted a milliliter per hour rate into a unit per hour rate so that I know the amount of heparin the patient will receive.
Okay. Vicki Walsh brought up a good question. You know, and you probably have seen it, you know, your pumps can do certain drugs
Yes,
and
they have
not.
them in the library.
Yeah, in the library. So it would be wise to make sure your pump is in that setting for heparin.
I would say so, yes.
Yeah.
Yeah, that would be one of the ones you'd really want to use the smart pump for.
Yes.
Yeah.
And so you definitely can go into that library. Okay, we're going to go flip them back up to the screen here. Any questions on those YouTubes?
No.
Okay, you're welcome. I was not able to get a pump here this morning, but I was going to say if you wanted to practice on the pump, you can here. I need to grab one, but there's none in the units I went through.
Oh, wow.
So they're all somewhere else. So I had a practice session here if you wanted to set up the pump or just even look at the heparin setting.
I got a chance to run some bank yesterday. So,
you know what the library.
I didn't use the library for it. I used the standard.
Okay.
It's been a while since I learned the library thing.
Okay. Just know that it's there. So here, and I've got the training domain set up on the other computer. We can add order sets. You can add your STEMI, fibrinolytic, and if you look over to the left-hand side of the order set, I've got a snapshot of it. There's a STEMI, fibrinolytic therapy pathway, and over to the right-hand side, it has these three things to initiate heparin on your patient. The injection part, and you just follow the order here. This one here is probably the one we'll be dealing with, is the infusion. And then they also have the order for the heparin assay. Okay. So what I'm going to do is.
So they actually start them with a bolus IV before they get the.
Correct.
Going. Okay.
Correct. So I'm going to go to the next slide, and I'll show you when you.
Sometimes they want a bolus and sometimes they don't.
It
The
depends.
physician,
Yeah. Depends. It could be an injection or whatever.
Yeah.
So when you hover over that, the infusion order, put your cursor over the blue They're part, and then you have this yellow drop-down window.
Wow.
And it gives you an order set detail.
Yeah.
So you begin your infusion of the 25,000 units heparin in D5, a 500 ml bag. And so you begin that at 12 units per kilo per hour. So you got to know your patient's weight. And then you round to the nearest hundredths unit for the initial infusion rate. And then 4,000 units for subsequent rate changes. Subsequent rate changes based on heparin assay results.
So what does that mean? I don't quite understand. Oh, maximum is 4,000. I see it. Okay, there's a long sentence. I see
It
that.
is. It's very long.
Okay.
And then, so you start your infusion, and 6 hours later, you're going to do a heparin assay check. So you're going to draw some blood, send it to the lab. They're going to send back the results. If the assay is less than 0.1, then you increase the heparin by 300 units per hour and give as needed subsequent boluses if ordered.
So we're managing the heparin drip not with PTTs, but with heparin assays. Okay, that's new to me.
Yeah.
When did that start?
That's a good question.
All I remember is managing it with PTT.
I think that's
Yeah,
what the
me too.
assay is the PT-PTT combination.
Oh, like
Do
an
a
INR, you
calculation.
mean?
Yeah,
Or-
you do a calculation on it.
Okay.
And then you check your heparin assay again. It's every 6 hours. After you do a change, you're going to recheck.
6 hours after every change, yeah.
But I don't believe we're going to hold patients that long in the PACU to do any checks. But you might get in the midst of that. Okay.
Yeah, just depends on how the bed situation is
Correct.
in the house.
Yeah, and you may have to hold them for 6 hours.
Or overnight, yeah.
Or overnight.
Yeah.
So after the 6 hours, you send another blood test in, and they do the assay. And if it's still 0.1 at 6 hours after the rate change, then notify the provider. If it gets increased, 0.1 to 0.29, you increase the heparin by 200 and give subsequent boluses, and then check it in 6 hours. If it goes to 0.3 to 0.7, that's your sweet area.
Do you have to call every time to see if they want a bolus?
Yeah.
Okay.
Or maybe he's got it written. Or
No-
she has it written.
Notify provider
Notify
if
provider.
less than 0.1.
Yeah.
Okay.
The sweet spot is 0.3 to 0.7. There's no change in your heparin infusion, okay? But then you'll check the assay again in 6 hours. If it's still 0.3 to 0.7, then check the heparin assay in the morning, which is kind of nice. If it gets bigger, then you can increase like 0.71 to 8.8, decrease the heparin infusion by 100 units. Check the assay in 6 hours. And if it gets bigger, 0.81 to 0.99, hold it for 30 minutes, stop the infusion.
So that drop down box is essentially this, right?
Correct.
That's pretty much identical to this
Yes.
as far as I can tell.
Yes.
So that's a little different than at St. David's. At St. David's, they wanted you to, if there was no rate change, you didn't have to check again for 12 hours.
Okay.
So this is different.
This is a little different.
Okay.
Yeah. And I like it because it's right there. You just hover over the order and it drops down if you ever want to
That's great.
read it. It's right there. And then, of course, greater than 0.99, you hold it for 60 minutes, decrease the rate by 300 units per hour. Again, check the assay in 6 hours after restart. Again, if it's still greater than 0.99 at 6 hours after the rate change, call the doctor, notify the provider.
And yeah, and it's different than using PTT. Those are, the same numbers.
Yeah, they're way different.
Way different, yes.
And they're not the same as INR either, I don't think.
Well, I think what we can do is
No.
look up on the, I want to look up assay. I'm going to add a order. Heparin assay.
Well, they haven't called us yet, so I guess nothing happening out there.
Good. So it's a routine blood collect. figure out. Let's see. Let me see what it says here.
While you're doing that, I'll peek out the door.
Okay.
Hey, you guys, we're in this conference room doing an anticoagulant thing with Lori, just in case you're wondering where we are.
I'm gonna have to, what I'd like to do, Charlie.
That was Susie and not you.
Okay. Find out what's involved with a heparin assay.
Yeah, I know. Thank you.
Again, it's usually every 6 hours they draw it. Is there a blood? I'm going to delve into that further.
Yeah.
Okay.
We'll let you get into that. Find us later about
I'll
that.
find it later. I'll get back to you on that. Okay.
I found info about it.
What'd you see? What do you find?
It's kind of long, but.
Go ahead. Read it to us.
It's
Oh, no, it's like 3 pages.
in small print.
Is it regarding PT, PTT, INR? Is it a
Yeah,
combination?
PTT versus.
Heparin assay.
Heparin assay.
Okay.
So I'll have to get back to you.
All right.
Laboratory dimensions is the name of the
Okay. I'm going to get, that's a good question. All right. When you're managing heparin drips, if you're doing any changes whatsoever, do your independent double check, because this is a high alert med. Okay, do it with another nurse. Documentation, you can go, I've got the train domain set up here, you can document, go to the MAR and document your initial heparin administration. The order will be put in, and you can barcode, you can do the barcode thing and initiate your heparin management. Vicki also mentioned if you're doing any changes on that one particular drip that's going, you could put in the comment section in your MAR, assay stated this, and then change the drip to this rate, just to cover your assets. And say that you made those changes. Okay. Handouts are over there. You can collect, and you have collected. And we talked about the Seton Anticoagulant Management website, and you're well aware of that. Again, this education credit is going to be downloaded on your Seton My Learning Center competency for this year. And then we're at the end of the program.
Okay.
Any questions, comments, concerns?
No, I think that's great. Thank you, ma'am.
You are
Great
welcome.
job.
Thank you for coming.
Yeah.
All
You're
right.
welcome.
And thank you.
And thanks for the postcards are really quite fun. Too.
Oh, good.
I
I'm
like
glad you
that.
like
Yeah,
that.
yeah, that
Thank
really
you.
is a nice touch. Look at that.